Taking Xarelto once a day with your evening meal is the most important thing you can do to help reduce your risk of stroke from AFib not related to heart valve problems. Therefore, it's important to work with your pharmacy to ensure your Xarelto prescription is properly filled each time and to remember to refill your Xarelto prescription before you run out. Every time you fill a prescription, it's important to check and make sure that you've been given the correct medicine at the dosage that has been prescribed specifically for you. If you were prescribed 20 milligrams of Xarelto, you will receive a triangular-shaped, dark red tablet with a triangle pointing down above a 20 marked on one side and XA on the other side. If your doctor prescribed 15 milligrams of Xarelto, you will receive a round, red tablet with a triangle pointing down above a 15 marked on one side and XA on the other side. If you are not sure which dose your doctor prescribed, ask the pharmacist to check the prescription. Tell all your doctors and dentists that you are taking Xarelto. They should talk to the doctor who prescribes Xarelto for you before you have any surgery, medical, or dental procedure. Talk to your pharmacist about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Some of your other medicines may affect the way Xarelto works. Certain medicines may increase your risk of bleeding, such as aspirin products, non-steroidal anti-inflammatory drugs, or blood thinners. It's helpful to keep a list of all the medicines you take and show this to your doctor and your pharmacist when you get a new medicine.
That was a lot of information, so let's make it real. Now may be a good time to create a list of all the medications you take so you or a loved one can share them with your doctor, dentist, or pharmacist. Be sure to write down the name and the strength you take for each medication. It can help to get all of your prescriptions filled at the same pharmacy location each time. So if you are prescribed medication from different doctors, the pharmacist will know about each of the medications that you have been prescribed and be able to determine if there are any issues or precautions that you should be aware of. Get comfortable asking questions and getting advice from trusted sources, like your pharmacist. In fact, your pharmacist is an important partner of your healthcare team.
What is Xarelto, rivaroxaban? Xarelto is a prescription medicine used to reduce the risk of stroke and blood clots in people who have a medical condition called atrial fibrillation that is not caused by a heart valve problem. With atrial fibrillation, part of the heart does not beat the way it should. This can lead to the formation of blood clots, which can travel to the brain, causing a stroke, or to other parts of the body. Treat blood clots in the veins of your legs, deep vein thrombosis, or DVT, or lungs, pulmonary embolism, or PE. Reduce the risk of blood clots happening again in people who continue to be at risk for DVT or PE after receiving treatment for blood clots for at least 6 months. Help prevent a blood clot in the legs and lungs of people who have just had hip or knee replacement surgery. Xarelto is also used with low-dose aspirin to reduce the risk of serious heart problems, heart attack, and stroke in patients with coronary artery disease, a condition where the blood supply to the heart is reduced or blocked, or peripheral arterial disease, a condition where the blood flow to the legs is reduced. It is not known if Xarelto is safe and effective in children. Important safety information. What is the most important information I should know about Xarelto? Xarelto may cause serious side effects, including increased risk of blood clots if you stop taking Xarelto. People with atrial fibrillation, an irregular heartbeat that is not caused by a heart valve problem, non-valvular, are at an increased risk of forming a blood clot in the heart, which can travel to the brain, causing a stroke, or to other parts of the body. Xarelto lowers your chance of having a stroke by helping to prevent clots from forming. If you stop taking Xarelto, you may have increased risk of forming a clot in your blood. Do not stop taking Xarelto without talking to the doctor who prescribes it for you. Stopping Xarelto increases your risk of having a stroke. If you have to stop taking Xarelto, your doctor may prescribe another blood thinner medicine to prevent a blood clot from forming. Increased risk of bleeding. Xarelto can cause bleeding, which can be serious and may lead to death. This is because Xarelto is a blood thinner medicine, anticoagulant, that lowers blood clotting. During treatment with Xarelto, you are likely to bruise more easily, and it may take longer for bleeding to stop. You may have a higher risk of bleeding if you take Xarelto and take other medicines that increase your risk of bleeding, including aspirin or aspirin-containing products, long-term chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, warfarin sodium, Coumadin, Jantoven, any medicine that contains heparin, clopidogrel, Plavix, selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs. Other medicines to prevent or treat blood clots. Tell your doctor if you take any of these medicines. Ask your doctor or pharmacist if you are not sure if your medicine is one listed above. Call your doctor or get medical help right away if you develop any of these signs or symptoms of bleeding. Unexpected bleeding or bleeding that lasts a long time, such as nosebleeds that happen often, unusual bleeding from gums, menstrual bleeding that is heavier than normal, or vaginal bleeding, bleeding that is severe or you cannot control, red, pink, or brown urine, bright red or black stools, looks like tar, cough up blood or blood clots, vomit blood, or your vomit looks like coffee grounds, headaches, feeling dizzy or weak, pain, swelling, or new drainage at wound sites, spinal or epidural blood clots, hematoma. People who take a blood thinner medicine, anticoagulant like Xarelto, and have medicine injected into their spinal and epidural area, or have a spinal puncture, have a risk of forming a blood clot that can cause long-term or permanent loss of the ability to move, paralysis. Your risk of developing a spinal or epidural blood clot is higher if a thin tube called an epidural catheter is placed in your back to give you certain medicine. You take NSAIDs or a medicine to prevent blood from clotting. You have a history of difficult or repeated epidural or spinal punctures. You have a history of problems with your spine or have had surgery on your spine. If you take Xarelto and receive spinal anesthesia or have a spinal puncture, your doctor should watch you closely for symptoms of spinal or epidural blood clots. Tell your doctor right away if you have back pain, tingling, numbness, muscle weakness, especially in your legs and feet, or loss of control of the bowels or bladder, incontinence. Xarelto is not for people with artificial heart valves. Do not take Xarelto if you currently have certain types of abnormal bleeding. Talk to your doctor before taking Xarelto if you currently have unusual bleeding. Are allergic to rivaroxaban or any of the ingredients of Xarelto. Before taking Xarelto, tell your doctor about all your medical conditions, including if you have ever had bleeding problems, have liver or kidney problems, are pregnant or plan to become pregnant. It is not known if Xarelto will harm your unborn baby. Tell your doctor right away if you become pregnant during treatment with Xarelto. Taking Xarelto while you are pregnant may increase the risk of bleeding in you or in your unborn baby. If you take Xarelto during pregnancy, tell your doctor right away if you have any signs or symptoms of bleeding or blood loss. See what is the most important information I should know about Xarelto for signs and symptoms of bleeding. Are breastfeeding or plan to breastfeed. Xarelto may pass into your breast milk. You and your doctor should decide if you will take Xarelto or breastfeed. Tell all of your doctors and dentists that you are taking Xarelto. They should talk to the doctor who prescribed Xarelto for you before you have any surgery, medical, or dental procedure. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Some of your other medicines may affect the way Xarelto works, causing side effects. Certain medicines may increase your risk of bleeding. See what is the most important information I should know about Xarelto. How should I take Xarelto? Take Xarelto exactly as prescribed by your doctor. Do not change your dose or stop taking Xarelto unless your doctor tells you to. Your doctor may change your dose if needed. If you take Xarelto for atrial fibrillation that is not caused by a heart valve problem, take Xarelto 1 time a day with your evening meal. If you miss a dose of Xarelto, take it as soon as you remember on the same day. Take your next dose at your regularly scheduled time. Blood clots in the veins of your legs or lungs. Take Xarelto 1 or 2 times a day as prescribed by your doctor. For the 15 mg and 20 mg doses, Xarelto should be taken with food. For the 10 mg dose, Xarelto may be taken with or without food. Take your Xarelto doses at the same time each day. If you miss a dose, if you take the 15 mg dose of Xarelto 2 times a day, a total of 30 mg of Xarelto in one day, take Xarelto as soon as you remember on the same day. You may take 2 doses at the same time to make up for the missed dose. Take your next dose at your regularly scheduled time. If you take Xarelto 1 time a day, take Xarelto as soon as you remember on the same day. Take your next dose at your regularly scheduled time. Hip or knee replacement surgery. Take Xarelto 1 time a day with or without food. If you miss a dose of Xarelto, take it as soon as you remember on the same day. Take your next dose at your regularly scheduled time. Reducing the risk of serious heart problems, heart attack, and stroke in coronary artery disease or peripheral arterial disease. Take Xarelto 2 times a day with or without food. If you miss a dose of Xarelto, take your next dose at your regularly scheduled time. If you have difficulty swallowing the Xarelto tablet whole, talk to your doctor about other ways to take Xarelto. Your doctor will decide how long you should take Xarelto. Xarelto may need to be stopped, if possible, for 1 or more days before any surgery or medical or dental procedure. If you need to stop taking Xarelto for any reason, talk to your doctor to find out when you should stop taking it. Do not stop taking Xarelto without first talking to the doctor who prescribed it to you. Your doctor will tell you when to start taking Xarelto again after your surgery or procedure. Do not run out of Xarelto. Refill your prescription for Xarelto before you run out. When leaving the hospital following a hip or knee replacement, be sure that you have Xarelto available to avoid missing any doses. If you take too much Xarelto, go to the nearest hospital emergency room or call your doctor right away. What are the possible side effects of Xarelto? The most common side effect of Xarelto was bleeding. See, what is the most important information I should know about Xarelto? Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Janssen Pharmaceuticals, Inc. at 1-800-JANSSEN, 1-800-526-7736. Please see full prescribing information, including boxed warnings and medication guide, at www.xarelto-us.com. Trademarks are those of their respective owners.